Good afternoon, good evening, wherever you are in the world. My name is Christine Auclair. I'm from UN Habitat. I'm the advocacy and campaign lead in the agency, and I'm going to moderate this Urban Thinkers Campus on the theme, the shelter gap. So to start this session, I would like to give the floor to Bert Smolder, who is the chair of the World Urban Campaign. Over to you, Bert.
Thanks, Christine. Hello, everyone. I would like to welcome you to this third Urban Thinkers Campus webinar. First, a big thanks to all the speakers who have accepted this invitation to speak on the issue of shelter. And also, of course, a big thanks to the Secretariat of the World Urban Campaign, Christine Auclair and Damien and Flossie, who have been organizing and have been doing a lot of work to make this happen. The Urban Thinkers Campus is an initiative of the UN Habitat's World Urban Campaign, and several people of you will know that, but there may also be new people, and it's important to stress the importance of the World Urban Campaign. It's an open space for critical exchanges and learnings between all urban partners. Presently, more than 200 partners are a member of it. And since 2015, more than 115 Urban Thinkers Campuses have been organized, engaging about 45,000 participants worldwide. So it has been very successful. The objectives of this Urban Thinkers Campus are to present actions on the ground in different contexts, so different parts of the world, and to analyze good practices and solutions in response of the COVID-19 crisis, extract lessons from the crisis and make recommendations for building resilience in cities and communities. And the recommendations will be shared widely and will serve as advice to city and community leaders, as well as to governments. This third Urban Thinkers Campus, will be on the topic of shelter. 1 billion people live in informal settlements and slums, in overcrowded, inadequate housing, and also in the other parts of the world where people live in more formal urban conditions. The conditions in especially the low income housing is especially in this crisis time are really hard. In those areas, immediate action is necessary to mitigate the effects of the pandemic. This webinar provides the opportunity to share experience how communities are dealing with the crisis in relation to housing. Let's start with introduction by a group of very interesting speakers. Over to you, Christine.
Thank you very much, Bert, for this introduction. I'd like now to go through the program. Yeah, so let me share. Are you seeing my screen? Yes.
Yeah.
So this is a program of this campus. So we had a welcome and introduction by Bert Smolder. We'll have an Urban Thinkers session of less than 1 hour with 6 different speakers. And then we'll have an interactive roundtable where even the attendees who are not speakers, panelists, will be able to speak and share their view. And then we'll have a conclusion. For your information, this is entirely recorded, and then you will be able to watch this session after the meeting. Before going to the first speaker, I just want to draw your attention to those different hashtags and handles, because we are also doing social media during the meeting. We're going to tweet on everybody speaking. So please promote this Urban Thinkers Campus and the eminent speakers we have here at the table. Thank you very much. Yeah, I'm going also now, before going to the first speaker, to have a little poll. So I'm going to ask you a question to know who is in the room. Are you a national representative of a government, national or local, a civil society organization, a grassroots organization, an academia, a media, individual, UN organization, other? And then the second question, are you working on advocacy, providing shelter directly, supporting the homeless, and others? So I'd like everyone to vote, the panelists, the attendees, and then now we have 51% of people who have voted, 61%, 65%. Please write.
That the host and panelists can't vote, so don't include
No,
that.
everybody.
That's right.
You can't vote.
We
No.
can't.
Sorry, I saw that you were able to vote. Okay, so we are at 82%, 84, 83. Okay, I think I'm going to end the poll now. So you can, I'm sharing the result. So you can see on your screen who are the people in the room. So 2% for national government, 7% for local and regional government, 22% from civil society, 2% from grassroots organization, 22% from academia and research, 0% from media, and then we have individuals 13%, UN organization 20%. So I guess we have a lot of UN Habitat colleagues and maybe other UN colleagues. 11% other. And then 20% of you are working on advocacy, 9% are working on directly providing shelter, and then supporting homeless, 2%, 69 others. So we will figure out when you speak, because everyone will have to introduce themselves, who are the 69 others in the room. So I'm going to stop sharing here. And now I'm going to ask Jane Katz, who is the first speaker, to start intervention. Thank you, Jane.
Thank you, Christine. And thank you, Bert. And thank you, others. This is really exciting that we're having this session today. I'm going to start with the session on housing and the impact on safe, adequate, and affordable housing. Home has rarely been more of a life or death situation. That quote by Leilani Farha, who is just completing her term as the UN Special Rapporteur for Adequate Housing. It's never been so true. And with the spread of COVID-19 around the world, families are facing both a public health and an economic crisis, further worsened by a housing crisis. A safe and secure home is the first line of defense in the pandemic, and the pre-existing global need for adequate and safe housing will only exacerbate the impact of the pandemic as it continues. So very quickly, this global health emergency has become a housing emergency. You know, we all know stay at home and save lives, which underscores how central the home is to the public health during a pandemic. It's affecting at least, well, we already knew that 1.6 billion, and I think there's a little error in this little slide here, but more than 1.6 billion people are in need of affordable housing and adequate housing, and that's pre-COVID. And another 2.2 billion have lived without improved sanitation, which is just devastating when we seeing the impacts on people's lives. COVID has shattered that reality for millions of others not expecting to shelter in place. And I think we're all seeing the unforeseen impacts on families with their lack of access to transit, livelihoods, food, education, medical, increasing domestic violence, and evictions. Personally, my family I have in New York City, and have a daughter who was expecting, who's now delivered a baby, but at the very height of the pandemic. I think we went through, how is she going to get to the hospital? How is she going to shelter in place and not get food going to a market? I think we're all facing some of these devastating issues around the world, and it's not only in developed countries, but developing and developed countries. Moreover, residents do not possess the security of tenure, including a lack of title or inadequate rental agreements, which means many live in fear of constant evictions. We have a program in Metro Manila at Habitat, and thousands of people who are homeless, roughly 3 million people reside in informal settlements in those areas. The International Labor Organization says that 38% of the global workforce has employment that is vulnerable during this crisis. So we're seeing that people all around the world are being impacted by this devastating pandemic, especially people who are living in settlements and slums, living in poorly constructed homes with lack of services and many overcrowded conditions. And we'll talk a little bit more from some of the other panelists on what the implications are of all of this. So on our next slide, these are some of the responses that Habitat for Humanity has taken, currently taking. We've been advocating to our own governments around the COVID-19 response in the United States, but we're also trying to respond around the world with blogs and social media as well. So some of the things that we've been trying to promote with governments and others is to protect the adequacy, affordability, accessibility, and stability of housing during and after the COVID crisis, including household and community-based water and sanitation initiatives, because people can't wash their hands if they have to go out from a slum area. We've been advocating for a moratorium on forced evictions, freezing of rents, delaying mortgage payments, and those who have microloans, trying to forestall their payments. And with people being unable to get to jobs, it's even more exacerbated. We're trying to address the financial needs of individuals and ensure the sustainability of housing construction markets. Those markets in the construction area where we've been working are really at a standstill. People are living outside of their homes, in some cases in tents for those that have already started their construction on housing. And it's been devastating to a lot of the families that we've been working with because we can't complete the homes that we've already started, or in some cases that we've started construction on. So we've recommended that we provide direct financial support to households facing economic loss and aiding those to households through relief and other efforts through the local housing markets, in some cases promoting cash-based programming, declaring construction and housing services as essential, which can continue during the crisis so that these critical markets can continue to operate, and supporting household-driven home improvements and community-based housing production and neighborhood physical improvement. We're also addressing the housing needs of informal settlements, or at least trying to do that through improved sanitation and trying to distribute hygiene kit support. We've been doing that in a number of the affiliates where Habitat has been working, is trying to get kits out to the families that we've been working with, and trying to conduct public awareness campaigns to reduce the transmission of COVID in some of the Habitat communities where we've been working to provide a healthy environment. So there are so many connections between healthy housing and having this COVID effort, the COVID responses. We're trying to also work with voices, enabling the voices of communities in their COVID responses, trying to find out ways that we can integrate locally the data on the demographics. We've heard so much about data and the necessity of data in tracking where the virus is, how many people are dying, how many people are in need, how many people need food. So we've been trying to work with communities, if possible, during this period. And we've been trying to convene a number of stakeholder engagement processes, and including this particular workshop, but a number of others where we can really figure out a way to help people during this time of crisis. Finally, we've been also trying to work in the area of going forward. What's going to happen immediately following? What are we going to do during a recovery? Right now, we haven't heard much about recovery because people are still increasing some of the number of people who are being affected by this. But what we're trying to promote during going forward, and I think we'll have more conversation around this in the discussion, is to ensure that access to adequate housing options are available for all, reducing overcrowding by enhancing systems for land use planning and implementing secure tenure mechanism, and working on the regulatory environment with governments to try to promote physical improvements in safe construction at all levels, to prioritize and subsidize the upgrading of informal settlements to avert future disasters and pandemics. We're working to expand the affordability through housing finance options, and we understand that nearly $83 billion has been removed from emerging markets since the crisis began, with about 80 countries requesting requests from the International Monetary Fund for funding. This will be really important going forward, that we provide the funding that's absolutely necessary, and working with the private sector to meet the demand for some of the low-income housing. We're also working to promote secure tenure rights and equitable access to land for shelter. That includes influencing customary practices and discriminatory laws that exclude women and vulnerable groups, ensuring strong land governance and administration frameworks, endorsing a continuum of land rights that embraces a plurality of land rights to increase housing stability, security of tenure, and investment, and preventing arbitrary forced evictions going forward. Of course, we're wanting to work with others, and including the World Urban Campaign and other coalitions and stakeholder groups in order to enable this to happen. We recognize the value of civil society and other partners working together in public-private partnerships and coalitions to address some of these issues. And then finally, to foster resilience and responsive communities through housing, ensuring that policies enforce adequate building standards for construction for healthy housing, and ensuring tenure security, which facilitates housing security during and after a disaster or conflict or community-wide health threat. Data is going to be very important, and hopefully we'll be able to work together in tracking and collecting data so that we at least have a better sense of what can be achieved. Thanks very much.
David, does it make sense for you to go? It sounds like Christine is offline.
Yeah, sorry, Christine, I think you may have been on mute. I assume that you've completed your
I've been
introduction.
Sorry to myself.
That's okay.
So I was saying, thank you, Jane. This is a very good presentation because it provides a very good framework, giving all the main issues arising, and is going to be a very good base for this conversation. So now I'd like to give the floor to David, who is at Compass Housing Services, and I'm going to share your slides. So David,
thank you, Christine. Okay, thank you very much, and hello, everyone. I'd like to start by acknowledging that I'm working tonight on the traditional lands of the Kaurna people in Adelaide, and I pay my respects to their elders past, present and future, and to Indigenous leaders around the globe. I want to talk about the way that the COVID crisis has amplified what we know about health divisions and the link to housing. Housing is a fundamental determinant of health. It's widely recognized, actually quite difficult to prove, particularly in medical terms, but we know from history, for example, of the link between key transmissible diseases like tuberculosis, meningitis, and the link to very poor quality housing. So I'm going to say a few general things about the health divide, as I'll describe it as the division between the health of the wealthy and the health of the less wealthy. We know this particularly impacts on people who experience homelessness. There are numerous studies that have measured that impact. I'll cite one that I think is one of the most accurate and rigorous that I know of, and it's a UK study. And it's actually determined that for a male experiencing chronic repeated homelessness, the life expectancy is 47 years. For a female, that's 43 years. And that's compared to the population average of 77 years. So we know that the most fundamental health measure in terms of life expectancy is severely challenged by episodes of homelessness. And we know that there are comorbidities of mental and physical health issues, addictions and substance misuse. We know the disease burden for homeless people is very high in terms of transmissible diseases such as HIV, hepatitis, antibiotic-resistant tuberculosis. These are very much clear health problems for the chronically homeless. When we move to less developed countries, we again see a huge connection between health and housing. The poor quality of both indoor and outdoor air caused by cooking, use of things like kerosene fuels, for example, pest and rodent infestation, parasite, malarial prevalence, temperature control, too hot, too cold when you need it not to be, and of course the heavy burden of sanitation and waterborne disease. These are critical dimensions. So what are the implications of COVID? And indeed, any pandemic would have similar connotations. So I think while we're thinking about COVID, we also need to think about the future and what next and where we might be with future pandemics. And we need to solve these problems for COVID, but also on a more permanent basis. So if we're looking at a homeless population, say in a developed nation, they've been immediately perceived as a susceptible population. Governments everywhere have recognized that homeless people are likely to be far more susceptible to both catching and transmitting COVID. Partly to do with street lifestyle, partly to do with homelessness encampments, a whole range of things, and of course their background, poor health, and therefore the likelihood that if they do contract COVID, they will have far more severe cases. There's also been, of course, the homeless have been perceived as a disease vector to the general population. And in many ways, I think this has prompted very rapid action by government. So certainly in the UK, most of the European Union, Australia and New Zealand, we have instantly provided accommodation to the homeless. We find ourselves with neoliberal governments very generously providing the homeless with 5-star hotel rooms, something that we could not have possibly contemplated prior to the COVID crisis. When we again look at informal settlements, particularly in less developed countries, we see major problems immediately. The density of population is the first one, preventing social isolation and social distancing. One of the most well-known slums, if we use that term, Dharavi in Mumbai, 1 million people in 0.82 of an acre. It's an impossible figure to imagine, a density of population, and how a disease entry into that context would spread so rapidly. We also know about water supply barriers to hand sanitization, for example. Generally, background, poor access to health and general facilities like, in the current context, screening and testing. And of course, a poor health base creates greater susceptibility and transmission as well. And the response, I think here, if you look globally, has been quite varied. We've seen the localization of medical services, development of quarantine sites, some testing in some countries, latrine disinfection, development of containment zones, and some countries even providing income support to enable people in those communities to avoid having to travel to work. So these are the kind of things that are emerging. And I think for me, moving forward, what we have to ensure is that we don't return to business as usual. This has highlighted the compelling need to address the shortages of adequate housing in both the developed and the less developed world. And I would like to think that World Urban Campaign will play a major role in advocating for making permanent some of those changes, but also building on them. And I also think the New Urban Agenda and the SDGs provide us the framework for a rebuilt society. And that's what I hope we will be placing our advocacy over the coming months. Thank you, Christine.
Thank you, David. It was really good. I think you are making very good points here, especially on the homelessness, which has already prompted immediate response in some countries. So we are now realizing how important it is to have a home, and safe housing is really going back to the center. At Habitat, we have been saying we need to put housing at the center, but now this is even more important. Now I'm going to give the floor to Kathy Klein. Kathy, she is in the International Network for the Prevention of Elder Abuse. Over to you, Kathleen. I'm going to put your PowerPoint as well.
Thank you, Christine, and hello to you all, wherever you are at whatever hour of the day or night this is. And this is a very good progression of speakers because, as Christine just said, I help represent those called older persons, which in UN language is 60 and older. And I feel that all of you in the audience either are at that population sector or certainly hope to reach it. And ironically, just as our prior speaker talked about how governments are having to deal with homeless people in ways they never did before, ironically, this horrible crisis is also making much more visible the growing population of those 60 and older. We have been relatively invisible everywhere. Only recently, the Secretary General and the Commissioner of Human Rights have put out statements specifically addressing those issues that I'm about to talk about. I've divided my short statement into two areas to help guide our conversation. One is what is occurring in the institutional care facilities, nursing homes, senior residents, older persons in prisons, those who are in refugee camps. What are the challenges? What are some of the recommendations? And the same for those who have chosen to age in place, those that live in their home or have always thought of living in a home. It's not a choice, it's a reality. So first, just so we're all on the same page, by 2015, the 1 billion of us 60 and older in the world is going to be elevated to 2 billion population, with 80% living in low and middle income countries. And I think, again, most people have thought about aging as something in Japan or Germany or some other developed country, Italy, but that's not true. It's happening at a far faster rate in, for example, the African continent. Fatality rates, as we're unfortunately learning from COVID-19, for those over 80 is currently 5 times the global average mortality rate. And according to the UN, an estimated 66% of people 70 and older have at least one underlying condition, one comorbidity that makes them much more at risk for getting the virus and having a bad outcome. So here we are with institutional care. As I said, this is something just becoming important and prominent in the media and for governments. They were not counted. Many of them are both public and private institutions. I was interested because the organization I help represent, International Network for the Prevention of Elder Abuse, has been doing webinars, one last Thursday and one almost right now, on this issue of nursing homes, and they're discovering that they were literally invisible. And when the count of countries with positive COVID-19 persons are including nursing homes, suddenly you see this large jump. What are some of the challenges? The challenges are that staff tend to work in multiple locations. So they're able to bring whatever they might have picked up from one location to another. They traditionally have very low salaries, work long hours. As some of them have become positive, they're not being replaced. Oversight responsibilities, again, we're discovering in nursing homes, whether private or public or residents, are not being adequately monitored by local or national authorities. A high density of residents have comorbidities. Just what our previous speaker spoke, it's not only in the informal settlements, but in these particularly low-income nursing homes or residents. There is a tremendous lack of data. We have no idea whether these people are dying of some ailment that they have or whether it's because they contracted COVID-19. There is neglect and abuse, again, because there's low monitoring. Ageism and discrimination in medical care. We hear people, including my country of the US, talk about, well, let's just let the older people die and the younger people can inherit a better prospect for lives. This has nothing to do with human rights. We are working very closely with the National Human Rights Institutes because older persons are one of the constituency groups that does not have a convention on the rights of older persons. So we are helping use their auspices to advocate on our behalf. And there's extreme isolation. Both Jane and David mentioned it, but what happens when older people are required and forced to live in separate rooms? They end up lonely, their families have no access, many of them don't have technology capacity, so they really end up depressed. So what are a few recommendations? That staff should only work in one institution, and as my 94-year-old mother is in one in Ohio that's excellent, the staff are tested before they begin their term. Provide the staff with appropriate protection equipment. Again, we're hearing not just hospital and nurses have no access to appropriate protection, but so do those working in these very precarious situations. Residents must remain in their rooms and use a mask if outside. They can't commingle. Many of them do have comorbidities and can pass on even asymptomatic situations where they don't think they have the virus, they could pass it on to somebody else. Many of these institutions are seeing that they have to segregate those who are positive. If you live 2 or 3 in a room, you don't want to pass it on to your roommate. If they have to go to a hospital, some of them are now recommending that when they return, hopefully okay, they're quarantined for 14 days. There should be testing of all residents. In the US, there's an expansion now of Medicare that permits social workers, clinical psychologists, physical therapists to conduct virtual check-ins so that people aren't left alone and depressed, and provide training. It's crucial that all the people need to be provided training. Switching now to those who choose to age in place or are aging in place just by default. Again, challenges, there's lack of support. Who is going to provide the food? If they're stuck in their homes and their families or caregivers, and particularly persons with disabilities, who is going to provide food, medication, and support? There's a lack of social interaction. They're discovering that that leads to depression, which again leads to lower longevity. Those living in informal settlements, we've already heard, are totally unable to have the physical distancing or access to adequate sanitation, water, or even healthy food. So recommendations for those living in those circumstances is that we're seeing communities are beginning to volunteer and set up ways to assist older persons restricted in their homes. They are providing food. You see people leaving food at older persons' doorsteps, neighbors checking on each other, offering information in various formats. Because as we know, even though many older persons are now pretty good at being able to Zoom or to get information, many of them also lack that ability. So they really are not getting the information that other people are provided with. We have to deal directly with the impact of ageism and accept that all of us have our human rights and duty bearers are required to service everyone. We need to provide access to social protection floors and Social Security. Many of us don't have universal healthcare coverage either at all or that are acceptable to include what we need. Most importantly, older persons need to be included in decision-making policies. There has to be, as Jane mentioned, a much better collection and use of disaggregated data. Many of the resources, even now, stop at age 49. So we have no idea how many older persons, for example, face domestic violence. And that, as we've also heard, is increasing, unfortunately, during this pandemic period. But there is hope. I want to just leave people with a couple examples of what you and others can do to make a difference. The disability group has a fabulous WhatsApp group going on with regional groupings, and they're making a difference. They're getting governments, local and national, to change how persons with disabilities and older persons are being treated. There is also opportunities through the World Health Organization that's launching a decade of healthy aging. Many of you may not have heard of their program that was started in 2007 called Age-Friendly Cities and Communities. That exists in 1,000 cities around the world and is doing the kind of interaction that requires governments and localities to pay attention to older persons. So I wanted to leave you on that positive note. Thank you.
Thank you, Kathy. This is very good. We have ignored too long issues of aging, and it's very important what you are saying. We need to address this somehow invisible population on which we have little information and to which we have paid very little attention in the last decade. So now this crisis is telling us we need to deal with aging population. Aging people need to be part of decision making on housing issues and the future of cities. So thank you very much. This was really interesting. Now I see Lorena has joined. I'd like to unmute you and to give you the floor. Are you with us, Lorena?
Yes, thank you very much.
Okay, thank you.
Thank you, Christine, Jane, and all for the invitation to participate in this very important debate. I'm Lorena Zarate from the Global Platform for the Right to the City and former president of Habitat International Coalition. I'm not sure if you have the presentation with you, otherwise I can share my screen.
Yeah, I don't have, so you have to share your screen. Thank you.
Yes. So basically, and taking advantage of the previous speakers already discussed many of the specific topics and the topics regarding the current context. I'm not sure if you can see that properly.
You have to put it in full.
Can you see well? Yes.
But can you do?
Yeah, I think.
Yes, that's perfect. Thank you.
Okay, great. So in these few minutes, I would like to highlight just some key messages that are arising from collective knowledge, really, and for decades long of working in communities all over the world, different organizations, hundreds of organizations, grassroots and academics and NGOs, also working with, particularly with local governments and advocating for national policies in several countries too. So I would like to focus on the kind of the bigger picture, if you want. So going a little bit beyond the current situation and the pandemic, and trying to stress some important issues. So on the one hand, the pre-existing conditions, but also trying to look forward in terms of the medium and long-term transformations that we all know we need, our societies need. So in terms of the bigger picture, I think it's important when discussing about housing and housing in cities in particular. We all know that for decades now, that we have dual cities or divided cities, and we can see these probably all over the world now, both in the global south and in the global north. So increasing inequality, and we know that what we see in the territory and the space is just a manifestation of increasing inequalities, socioeconomic inequalities in our societies. These have been widely discussed. But we know that very little was being done even before this pandemic. And we know that the pandemic and the crisis related with this pandemic is just exacerbating these pre-existing inequalities. They're both material, but also political, symbolic, and so on. So some key questions here, I think, are basically two. One is make sure they're being now taking into consideration those pre-existing qualities. And we're certainly hearing that they are not. In most cases, they're not. They're not considering different situations, different families, different individuals, and so on. And also even the housing conditions, and even in cases where they're considering so-called informal settlements, not really taking into consideration the differences within those settlements. But the related question is if the measures that are being taken now are actually addressing those inequalities and are going to change those inequalities or just deepen them. So, and we all know that we need to take this opportunity to actually move forward in some so-called structural transformations. We also know that the current situation is just bringing visibility to a long-standing housing and habitat crisis that many of us have been talking about for decades now. And for many of us, this is not just a housing crisis, but it's a human rights crisis. Yes. And this is very important because that changes the framework, and then changes the focus, and also changes the kind of responses that we're going to provide situations. So, of course, taking into consideration a wide range of situations, and we hear already the numbers, and more than 1.5 or 6 or 8 even billion people, and that number is certainly growing. Homelessness has been growing since the last 2008 crisis, by the way, and we need to be very careful that there was actually a housing crisis, and we need to be very careful that the responses they're going to be provided to address the current situation are not going in that same direction, because we know that austerity measures and so on were terrible, had terrible impacts in people's lives, and increasing homelessness, again, both in the north and in the south. So, but that variety of situations means that we also need a variety and diversity of policies and measures. And in fact, as we all know, that's not what has been seen. In most countries, housing policies have been actually focused, when they exist, been mostly focusing on providing new houses, building new houses by millions, but in very conditions very far away from cities and opportunities and so on. Very small houses, all the same, as you can see in this picture, in that case coming from Mexico, but you can see similar projects that were like much growing and during the past decade and a half or so in different places. And not only not solving the problems, but actually creating more problems, socioeconomic problems, environmental problems, and so on. But also, we know that if you look at the bigger picture, we also know that we have in our cities a lot of empty spaces, a lot of empty buildings, a lot of empty infrastructure and facilities that are not being used. And so, the approach from right to the city function, a key notion, a key principle here is the social function of property, land, and city. So basically means that, for example, right now, several governments, in particular city governments, and this is interesting too, city governments are taking measures to provide home for homeless people, as some colleagues already mentioned. Like in the case of Barcelona, but several other cities doing the same. So empty houses, empty hotel rooms, and so on, to provide shelter for homeless people and other people needing need to isolate and so on. And this is important. This is a measure to take care of the emergency, but we know that behind that is a measure that can actually change the conditions of inequality and the needs of the communities. We know that in many cities, the amount of empty spaces are actually the numbers at the same of the people in need to find a home. So I think we need to broaden up the discussion and the discussion of options in terms of public policies. We also know that if we look at our cities, and in particular in the Global South, between 30% and more than 70% of our cities are being built by the people. And usually this is seen in a very stigmatized way and with very negative labels like informal, irregular, marginal settlements and so on, or slums and so on. So for decades now, from HIC in particular, but also with some other colleagues, we have been discussing this issue and framing this in a different way as the social production habitat and the social management of habitat, and actually trying to understand both in qualitative terms, but also in terms of the contributions to the micro and macroeconomy, the situations in these neighborhoods and how they actually contribute to the city itself, to society as a whole, to the economy as a whole. So if we know that 60% of the population worldwide is living in the so-called informal economy, I think it's time for us to actually question those labels and start framing our regulations in different ways, because that's actually the economy that is maintaining people's lives. And the same now with this pandemic, because if we don't consider that inside the economy, then the measures that are being taken are not considering those peoples and the needs for the majority of the people. And we also know that these settlements provide spaces not just for living, but also for production and for economic activities, that they address also food security and so on. And this is becoming even more critical in the current situation. So if we have policies supporting that, we have really good results, like the housing cooperatives in Central America and South America and so on. We know that this is an alternative solution, provided good, well-located land and affordable finance mechanisms that not go through banks and the banking system, and technical assistance to actually improve the quality of these buildings. So we know this is possible. There are several programs in different cities and countries now, but actually they're very small, and with very small money, with very little money, if we consider the amount of people that need the support. So, and we also know that women have a role. This is not applied, it's not recognized, and this is not support enough. So in closing, just to highlight some issues that are already there, we have been working together on this for a long time, and in particular within the Habitat 3 process. And many recommendations are included in the new urban agenda. And I have to say that I was a little bit surprised that the new urban agenda, as far as I could notice, was not mentioned in the new response plan that UN Habitat is putting together in the context of COVID-19. And this is worrisome, because there was a lot of work that was put into that, collective work, but also because they are very were already recommended there, that could be very, very important, not just for addressing this current situation, but also moving forward to the medium long-term transformation. So people at the center, we all know that what means, and it's clear now in the pandemic what that means. The territorial approach, that we need to integrate the multiple dimensions, that for sure. We cannot see sectorial policies trying to address health here and food security there and jobs here and so on. So the territorial approach can help us actually hold together. The guidelines for public policy, human rights provide clear guidelines for public policy in terms of what are the obligations, what the kind of measures we need to take and how to monitor those and so on. And also, of course, co-responsibility and more and better coordination. And these among different actors, of course, but also among different scales. And this also became clear in the current pandemic, the need for more coordination and better coordination, particularly between local actors, national actors, and international actors. And we've seen a lot of action in terms of local governments trying to really address the situation. Some national governments being very slow or very general and not taking into consideration the specificities of different localities. And we really would like to see a strong role of the international community and the international agencies and multilateral agencies in general. So just that one last slide to share with you that we, with different organizations, academia, civil society, and also local governments, just launched this call online to try to map the thousands of different initiatives that communities are taking at neighborhood level, and try to put those together and see how we can support those and move forward and in an international coordinated way. So thank you very much. Looking forward for our debate.
Okay, thank you, Lorena. This is very, very nice. I think you are asking deep questions here. You are warning on the post-COVID-19 crisis, and are the current measures going to widen the gap? And the title of this meeting is the shelter gap. Is that gap going to be widened? Can housing continue to be treated as a commodity because the business model doesn't work, because it's generating a human rights crisis, a potential human rights crisis? And I like your point on going back to the fact that 70% of housing is being built by the people, because you are going back to the debate of Habitat 1 almost in 1976 in Vancouver, the first UN conference on human settlement. What is informal housing? And there are alternative models to the current market approach of self-construction, cooperative, etc. So I think we need to really reflect on this crisis, and this is forcing us to reflect on what's going on and what is right, what is not right, and what can be improved. And thank you for mentioning the new urban agenda. It's our guide to the next 17 years. But I think going back to Habitat 1 would not be a bad idea. That's my opinion. Okay, so now I would like to give the floor to Julia Lavagna. She's from UN Habitat and she's working on housing. So over to you. Maybe Lorena, can you stop sharing your screen? Thank you. Thank you.
Hi, everyone. This is Julia, working with housing with UN Habitat. Thank you for attending this meeting. I see a large number of participants and a great level of speakers that are our partners, usual partners with Habitat. So maybe I'll just go over the slides very quickly, but I am glad to see that there's a great level of consensus. I think that what I will say, it will be just a reiteration of what has been said by our partners here during this webinar. And I am glad to see that there's a consensus, and then it's a strong basis to start building and moving forward in looking beyond this crisis. So as many of you said, there's a large number of people in need of housing, and this need was already existing before this crisis, this pandemic crisis. We have seen even more now during this crisis that housing is a matter of life and death. And that's exactly why we say and we keep preaching that housing is a matter of human rights. It's not just a commodity, as you said. So the fact that now houses is again at the center of this crisis is because it was already an issue before. And this crisis, this COVID crisis, is just exacerbating a problem that was existing and we were maybe failing in looking at with the attention that it should deserve. So what are the immediate action that UN Habitat has been putting in place together with the partners and that we recommend overall to governments at all levels? The immediate actions aim at containing the spread of COVID-19 and includes, of course, providing emergency accommodation with all the people with not secure housing, which includes homelessness, of course, but as well as people living in slums and informal settlements. We are putting in place emergency hand washing facilities in countries, Kenya being the one where we are currently based with our headquarters. We're working closely with the governments, and through our programs, we are supporting the local communities in strengthening their facilities for hand washing and sanitizing. And we're also supporting the governments of Kenya, for example, in making sure that evictions and relocation do not take place during this crisis period. So this is another measure that we are strongly advocating for with all governments, is that in order to keep securing the right to adequate housing for all, governments should suspend evictions and relocation during this particular challenging time. So finally, we are looking into how to provide basic needs within vulnerable communities and neighborhoods, and as well as suggested previously, trying to enforce the deferral and the moratorium of payments of rents and mortgages to provide a relief to all those affected by the crisis. But I think that we are now, since we are really in the middle of this crisis, we should not lose focus on what is going to come next. We were unprepared to handle this crisis. We cannot be unprepared to handle the reconstruction. So we need to keep looking beyond this crisis. We need to really be focused on what is coming next, how we're going to rebuild after this crisis. And that's why I would like to put greater emphasis on the medium and long-term measures that we are trying to put in place with our partners and with government. So what do these include? And maybe we can move to the next slides. We want to see this crisis as well as a huge challenge, a huge global challenge, but also as an opportunity. We cannot go back as business as usual. I think that we all agree that our life has changed, our work, the way we work has changed with this crisis, and why the housing sector should not change as well. So what we are trying to really promote is the idea of looking back, learn from our mistake, and start addressing this really long-standing housing crisis that has been going on now for more than 2 decades. We need to start addressing the shortage of adequate and affordable housing. This means a huge revision of policies and regulations that will include including housing development. It means basically for us, we see that as a twofold approach. First is recognizing housing as not just a roof, but as a human right. So this should be really the basis where the new discussion for reviewing the housing sector should start from. Secondly, we see housing as a shared responsibility. We cannot think that housing is just responsibility of the national government or of local governments that are in the front line in dealing with pressing issues, or of the private sector. Everyone has a stake in this. The civil society alone and the academia are not enough to advocate. We need to, everyone needs to take on the responsibility, which includes as well the private sector actors. In order to do business, in order to keep the business flourishing, they probably will have to revise the way business needs to be done. There are different ways of doing housing that are profitable and sustainable at the same time. So we are really looking with working with all our partners that we have, governments, private sector, civil society, and academia, to start changing the approach to this housing crisis that has been just reaching levels that we haven't seen before. So what we are trying is to set relief programs that do not only postpone evictions, but they are trying to approach this issue in a different ways. We are trying to see how the social housing stock can be increased in innovative ways. And also we are looking into what are the next solutions? How can we solve homelessness? It cannot just be a temporary shelter for homelessness to solve the pandemic issue, but it needs to be a longer term strategy. So what does it take? Overall, I think there's a need for a shift in considering housing, as we said, from a commodity to a human right, and how this will be translated into policies and regulation. This is really not only up to us, but it's a matter of spreading this conversation with as many stakeholders as possible. So I am glad to see that we have a strong level of consensus here. I would like to use this as a basis and as a platform to scale it up. So the real challenge now is really how do we use this force and this strong voice that is raising from the bottom, and we bring it up. We coalesce together to bring this up at the level of governments, and how we support cities who are in the front line to advocate for adequate resources and capacities in addressing housing issues. So I just would like to leave this as a reflection for this panel. I will not repeat myself over the concept that have been shared with the other panelists, because we completely share this position with them. And I think that what I really would like to put forward is, how can we reinvent the housing sector? I am concerned to see when we read in newspapers that the housing market is changing, and now there is a greater demand on housing with terrace and balconies or gardens because of the lockdown of the pandemic. But is this really how the housing market is changing? Is this really the direction? Because it sounds like business as usual. So how can we go and have a deeper structural change? UN Habitat is working towards this change, or has been working towards even before the pandemic. Is glad to have partners on board in continue this work, and would like to take this as a new opportunity, as a way forward to change the way we do business. Thank you.
Thank you, Julia. I think that was really good, because now it's a nice way to go to the next conversation and exchange with the panelists on what are the next steps, what are you outlined already, the medium and long-term measures, the need to revisit national policy, to reinvent the housing sector while working together with different partners. How can we do that? We have little time. We have another half an hour, less than half an hour. I think we can go directly to the roundtable. The roundtable, let me share my screen again. Okay, so we are starting the roundtable, where we want to involve everybody. So we have attendees in the room. In total, we are 71 here in this roundtable. And we have two questions. What are the housing and shelter gaps that communities are facing? Number one, so basically, what is your experience in the different countries? So from your different organizations here attending this meeting. And the second question is, what are the proposed solutions? And basically, what is the way forward in the terms that were put by Julia somehow very well. So what I would like to do is invite everybody to express themselves in the chat. I'd like to see who wants to speak on the first question. You can raise your hand in the chat. You can also, I'm going to stop sharing because I can't see the chat. So let me see the chat. And basically in the chat, just say, I want to speak and I'm from this organization. That will be enough and I can give you the floor. Okay, I see 3 new messages. Maite Rodriguez from Guatemala and the Women and Habitat Latin America Wild Commission, great intervention from all of you. Thank you. So these are more comments. Anyone want to speak from the attendee? I see Rebecca here. Please introduce yourself. I'm giving you permission to talk. Introduce yourself and you are responding to the first question. I'm going to unmute you.
It looks like she's still muted.
Or she's muted herself.
Rebecca, unmute yourself.
Rebecca, can you unmute yourself to talk? Because you can talk, unless she's left the room.
No, she's there.
She's here. Rebecca, over to you. Introduce yourself, please.
Hello, can you hear me?
Yes.
Yes.
Hi, please can you repeat the question again? There were a lot of questions.
The first question is about what are the housing and shelter gaps that communities are facing? So what is your experience in your country? Where are you from? What is your organization, please?
Okay, my name is Rebecca Roberts from Lagos, Nigeria, and I work with an organization that supports slum dwellers and more recently internally displaced migrants who are coming into cities who are unable to penetrate informal communities. In this period, one of the things that we're facing a lot is rapid eviction. So the government is, demolishing slum communities, for those who live in the slums. So there's a housing insecurity, even in this time. And also for the other category of vulnerable people who are not necessarily living in slums, but live as homeless people or in unsafe shelter under the bridges or wherever they can pitch their tent. The pandemic exposed them. So what it means is that ordinarily, the city of Lagos or even the government is not aware that people are living in certain places, people are pitching tents wherever they can to live. But during the lockdown, because everybody was at home, these people were exposed and many of them were forced to live where they were beaten up, many of them were arrested, so it's increased a lot of secondary displacement, due to the lockdown crisis. So for us in Nigeria, it's a very complex and complicated situation, and it's one that requires policies and laws. So for a period like this, there should have been like something preventing the government from causing further homelessness, but then there wasn't. So we would require our government, we require policy that guides against further vulnerabilities in times like this, and also maybe a policy that doesn't allow the government or any agency to send away people that are living in certain places, no matter the situation, because it made things even worse for very vulnerable groups. Thank you very much. I hope I made sense.
Okay. Yes, thank you very much. I see Malik from Enda Tiers-Monde is here. He would like to speak. Malik? I'm going to give you permission to speak. Allow to talk. I don't know, Malik.
Alex on mute still.
Okay, d'accord. Thank you very much.
I can hear you. Yes.
Hi, Christine, Kate, all these nice speakers I do like, and I was very interested by your very, very interesting presentation in this context of the COVID-19. In our countries, we are very afraid about this pandemic because we are all locked down now, but we are taking care about the community where we are working with, in also trying to develop strategy with them, helping for distributing information, also information regarding facilities to access to the barriers and all these kind of things. But we also have been working a lot on the process of the development goal, and we are tackling with two objectives was housing and water, and all these are the very, very big issues at this time of pandemic, as you have raised in your presentations. And I think that to respond direct to your question is the gap that this community are facing is a lack of policy from the government and lack of strategy for options of finance, while the community have developed and have demonstrated a lot of capability to help themselves without, any help from the government and local authorities. I think this is my position. I would like to let you from there, but I think in the perspective, now government have discovered, this very lack of capacity from their sides, and I think we should be taking this in another way from now. Thank you very much, and for giving me this opportunity.
Thank you, Malik. Very good point. Can I see Noor Tayed want to speak. I'm going to unmute you. Noor, over to you. Introduce yourself, please.
Hello, can you guys hear me?
Yes, we can.
First of all, thank you very much for this talk. It was really interesting. My name is Noor, and I'm an academic. I work in Saudi Arabia at the moment. Now, I would like to say some things about the situation in Saudi Arabia, which is very relevant to the shelter crisis and how it is affecting the marginalized groups the most. Now, what is happening here is that the crisis has highlighted an already existing bad housing conditions for low-income migrant workers who are living in crowded and unsanitary conditions. Now, the results of this are seen in the infection rates, which are concentrated among these groups, making around 80% of total infection rates in the country. The government tried to respond to this by moving migrants to other safe locations in order to relieve the overcrowding. And in the positive events, actually new regulations were emerged regarding the conditions of the housing, specifying occupancy and space and hygiene conditions for migrants. And this also was backed with inspections and fines imposed on non-compliant employers. So in conclusion, I'd like to say it is unfortunate that such problems were only responded to in the light of the pandemic. However, we can say that this has opened a new window for positive change, which would hopefully lead to something more equitable and sustainable. Thank you all.
Okay, thank you very much. I think the issue of migrants is a very important one in many countries. We have not talked too much about it, and I think it's a very good point. We should actually probably have another Urban Thinkers campus on that. So any other, I see Samuel Dodowa Benya Senesi. I'm going to allow you to talk. Welcome, introduce yourself. Samuel, unmute yourself, please. Samuel Dodowa.
Yes, can you hear me?
Yes, very well. You can even put your camera on if you want.
Okay, I'll prefer to speak without a camera.
Okay, okay.
Yes, I'm Samuel Senesi. I'm from Sierra Leone, but I'm currently living out of the country, but I follow the happenings in the country at the moment during the outbreak. And one clear thing I've picked up from the current situation is the lack of clear definition of vulnerability, the vulnerable groups. So in the outbreak, we've had a lot of social interventions from the government, and they are targeting vulnerable groups. But in the process, we have a lot of people who are left behind because the definition of vulnerability has been limited to people with disabilities. And then, just like the caller from Nigeria has stated, during the lockdown, we came to realize that there are a lot of people who have been left out, who are homeless. They didn't have access to the social safety nets that the government provided. They didn't have access to the food supply. They didn't have access to shelter. They didn't have access to the sanitary facilities that were provided. So within this definition of vulnerability, I think it's something we should really rethink about the definition, especially in the context of the COVID-19.
Okay, that's a really important point. And actually, the first campus we had on Monday was on facing urban vulnerabilities. And this was something raised, I think, how do we define vulnerability? And that has a lot of implication. And that should be put at the center of policies, and in particular housing policies. Very good point. Thank you, Samuel. I'd like to come back to the, now I don't see anybody who wants to speak from the attendees. I'd like to go back to the panelists now to reflect on now the recommendations. Yeah, many of you have put recommendation in your presentation, but we have now 13 minutes to go. So I'd like to open the floor for, to recap what are the key recommendations to the immediate pandemic and for the future. Is that all right?
Sure.
Yeah, yep. I see Catherine who wants to speak now.
Well,
Catherine, over to you.
Well, it's kind of related to what Julia was saying, because the recommendations of what UN Habitat is doing and wants to do in the future are excellent. The issue for those of us who have felt left out too often is how do we access the policies within UN Habitat? And I've learned in my work that there used to be a focal point for older persons, for aging, which was described out of Habitat 3 as one of the 10 emerging issues to be offered. And so my hope is that in the future, and not too distant future, within UN Habitat, maybe within Angela's unit on human rights, we could once again have a focal point on aging, as well as a separate person representing persons with disabilities, because they have, as I said in my presentation, there are many common interests, but then there are different ones. So that would be my recommendation in order to, for example, bring the attention to UN Habitat more clearly of some of the projects and initiatives we have going, including the World Health Organization Age-Friendly Cities, the focus on using universal design in all the policies going forward so that we all benefit. Thank you, Christine.
Thank you. Jane?
Christine.
Yeah.
Oh, sorry.
Oh, go ahead. Oh, all right. Yeah, I just wanted to mention, looking at some of the chat questions and things, that people are still being evicted, and in a lot of these slums. And so I want to go back to the recommendation around security of tenure that I think is still quite something that at least would be a way to potentially have some kind of property ownership of people who are living in slums, so that they have some security themselves. And I think that that would be the case as well for some of the other issues around being bulldozed or other things, that having that security is one I guess predecessor to building the housing and having that secure house. We're working in right now in some disaster related areas to try to map a little bit more clearly the communities using technology, and with all of this new technology, even with cell phones and others, to be able to establish some kind of documentation on residency in a disaster. So that would be one recommendation that I would offer, that I think is still really important. And I know that we've had campaigns before at Habitat as well as UN Habitat on security of tenure.
David?
Yes, listening to our speakers around the globe, something struck me that the world is searching for a vaccine for COVID, but that may be good for one season. We may never find one. But if we think in terms of social immunization, by building the right to housing as a human right for all, we actually create a resilient population in every location that is far more resistant to disease, is far more able to be quarantined and to be socially isolated for future pandemics. So I want to really advocate for this idea of a social immunization that creates the conditions for resilience, particularly in vulnerable populations, by providing them with adequate housing.
That's an interesting proposition. Anybody else? Lorena? Yes?
Yeah, thank you. Can you hear me?
Mm-hmm.
Yes.
Yeah. Sorry, my connection is really, really bad today. I was also trying to read the questions and the comments on the chat, and 3 quick comments on that. I think, and both, again, addressing the pandemic and the crisis, but trying to think about the medium and long-term transformation. So one, I think it's urgent for all of us to say it out loud and again that we must stop evictions everywhere. And I think we have been saying that for a long time now, but it's not enough. And it's still happening. We was just reading about that and hearing about that, even with some good intentions, like de-desertification measures in places like South Africa. We just sent a letter to the president there because we are really concerned. They're trying to move forward in these policies in some cities in order to generate more space for people, but actually displacing people once again. And we know that that's very often a really, really bad idea. So we really need to put forward that, and evictions not just in informal settlements, but also renters and so on. So that's a related issue. We know that rental policies and rental housing has been out of the agenda for the past 35 or 40 years and slowly coming back to the agenda. And we know that at least 30% of the population in our cities is living in rental housing. So we really need to put that on the agenda, back on the agenda, and have a collective voice on regulations on that. The second point is bigger than that, of course, and it's in general regulation of the land market and the housing market, because we know what happens when we don't do that. So basically, an inverse progression of prices going up and salaries and income going down. And that's not sustainable. I mean, not even in economic terms, not even in neoliberal, traditional, neoclassic economic terms. So we really need to start that discussion all over again and see how we can collectively act upon that and make places for people to live and not just empty cities, then they start looking all the same. And finally, I think it's the issue of decision-making and democratic institutions and practices, because we know that we were lacking that before, and we know that there's a current risk of centralization and bureaucratization because of the need of urgent action and so on and response, and that's worrisome. And we know that some countries are already going into that direction, and authoritarian regimes, even under so-called democratic elections. So we need to be very careful about this and push forward for a more radicalizing the democratic measures and institutions from the neighborhood level up to the international level. Thank you very much.
Thank you, Lorena. Julia, you want to say something?
Yes, just, well, thank you for all these inputs, because I think they're all very valid and they constitute the basis of our work on a daily basis. Maybe just adding on those and building, I think there are 2 important points that maybe we're not stressed enough. One is this conversation needs to start having a broader audience. The private sector needs to be on board. And I think that it's not enough for only international organizations and civil society and academia to lobby together to go to governments, but we need to have the private sector. It cannot be seen as the enemy, it needs to be seen as a partner. And we need to find a win-win solution that can work for both. That's the only sustainable way forward that I can see. Housing cannot be done without private sector, so we need to get them on board. And we need to speak a language that they can understand, and then we need to come with a common ground on which we can build on. And secondly, I think that we should stop looking at housing in such a sectorial way and start looking at the linkages that housing has with social policies and economic policies. Housing, it's fitting in a broader context and in a broader environment, and by being a human right, it touches on social policies. And by being a huge sector and contributing to the GDP of a country, it is also an economic driver. So we need to start looking at these linkages to strengthen the role of housing in both areas, in the social and economic area. So these are the only 2 points that I feel we should add to this list of recommendation, and that can help us shaping a new way forward. Thank you.
Okay, thank you very much, Julia. That was a very good conclusion. We have only 3 minutes now. I will now conclude this meeting. So, as we said from the beginning, a house, a safe home has never been so important, and it's the first line of defense for families. We have seen a lot of issues in this COVID-19 crisis, and it's an opportunity now to build back better in the recovery. However, we have not heard much on the recovery, as you said, Jane, from the beginning. We are now in the fire of action. We are trying to find solutions immediate to the homelessness, to the retiring homes, etc. But there is a lot of work in front of us. As Julia said, it's about redefining policies, putting housing at the center, but properly at the center, revisiting security of tenure, revisiting the right to housing, secure tenure, as I said, adequate standard, affordability. So all the multi-dimension of housing are exploding now in front of us in this crisis. So I think, yeah, this is probably one of the most important theme of this COVID-19 series of the Urban Thinkers Campus that we have. I think we need to have another series of campuses in the future on that, on the recovery and on the long-term plan, and revisiting, reflecting on the new urban agenda, and doing that together as all the partners of the new urban agenda, including the private sector. We have Bert Smolder here at the table, who is from the private sector as well. He was opening, and he knows, bringing the grassroots, bringing the elderly, the young people. We have not talked about the young people so much here. The media, you know, to bring this to a new level of conversation and to expand it. And of course, the national government and the local governments, they are key. So now I'd like to share my screen again for the next steps, to show you what are the other campuses coming up in the next few days. So up to the end of the month, we are going to have another 6 UTCs, one on the safety aspect, so talking about domestic violence, police violence, other type of violence. The same safety gap in Latin America in Spanish. So we'll have a UTC that will be entirely in Spanish, run by the Wairu Commission. Number 6 will be on community leaders at the front line. The importance of communities has been really highlighted from the beginning of the first campus, second campus, and this campus. You also talk about the importance of community leaders and their role. So this is a theme in itself. The issue of the wages, social security, small business are important. Then number 8, planning and design for pandemic urban resilience. So this is a very important one where housing can play a role also. And finally, reporting during the pandemic. So we'll have key media here, from the grassroots media to the mainstream media, joining the conversation, and that will be at the end of May. Again, we are going to share all your recommendations in stories online on the UN Habitat website, the World Urban Campaign website as well. And we need to use this as material for the next steps for the World Urban Campaign and for all those who have joined the COVID-19 campaign. So before saying my last word would be that join the COVID-19 campaign. It is online on the UN Habitat website. There is a share online form for that. If not, you can write to me directly, and then we will put you as an active participant of this campaign. And I will end here by saying thank you very much.